One of the questions or behaviors, that parents often point out to us or usually concerned about is when you have a child that's on a spectrum and they're engaging in what we call automatic maintained behaviors, as in the automatic reinforcement, meaning there's no external variable reinforcing that behavior. The child or the individual isn't engaging in that behavior because they're getting some reward from the outside, from the social integration. So you'd see some saying, oh, they are steaming, which is like the old language is still out there. And they're like maybe flapping or turn, looking at things from an angle, such similar responses. And the question is like, what do I do? Here is what I usually say, or something I want us to stop and consider as parents. Why is that child engaging in that behavior? Should always be the number one. Every behavior serves a function, right? So why are they flapping? Why are they looking at things from an angle? If we can identify the why, then we can begin to see how to address it. Okay, so question I ask parents sometimes is like, do you whistle? And they go, yes. Do you occasionally sing in the shower or hum? And they go, yes. I'm like, okay, exactly. You're doing exactly what that child is doing. The only difference is that the part of our brain that switches on to say to us, okay, it's enough, isn't quite developed in this neurodiverse child's situation. And so we need to teach. Now, bear in mind that we may not be able to place that behavior on extinction or stop the child from engaging in it completely. Automatic reinforced behaviors are one of the most complex behaviors to work on, to have them stop. So that's what I mean by extinction. So sometimes what could happen is, if it's so rapid, okay, the frequency is occurring at a very high rate, what we could then do is think of how else we can use that behavior. Maybe let it serve a reinforcing function. Okay? Sometimes too, depending on the topography, meaning what does it look like, you can simply implement a differential reinforcement of incompatible behavior. So maybe the person is constantly snapping their hands or whatever. Think about what else they can do with their hands. Meaning they can't be doing it and be snapping at the same time. The other thing that we want you to also think about really deeply is it presenting a risk to that child or to anybody else? Is it of safety concern? If the answer is no, then why bother? Is it impeding their learning? If the answer is yes, then you can do one of the numerous things that I've mentioned. If the answer is no, just leave it. And guess what? Sometimes it may actually be that there's something interesting. If I flap my fingers across my eyes long enough, there's motion, there are things going on, and the person may just be curious. And because they cannot vocalize, they can't tell us about it, they just keep doing it. And so we're like, what's going on? So cut the child the slack, give yourself grace, and realize that if it ain't broken, don't try to fix it. Thank you.